me start from the beginning. And the reason I want to start with this one is because I gathered that a lot of the pre-wellness hub, questions that we received was more about rationale. Why are we doing what we are doing? So what is the rationale behind the directives and the changing guidelines that we have? So I thought I should start with this introductory slide just to set the stage of this discussion so that I can bring everyone on this call today up to speed with how the virus has evolved over time. So as you all know, at the beginning of the pandemic, we're dealing with the wild type COVID-19 in December of 2019, December of 2019, when the virus was discovered. In Canada, we had our initial first wave around the early spring of 2020. And we've seen the evolution of the virus from the alpha, the beta, the gamma, the delta. And then in November of last year, there was the emergence of the Omicron variant. And now we know that there are sub-lineages of this Omicron up to BA5 that was recently documented by WHO. And there are even recombinants between different Omicron variants, the XF and XD and XE, and so on and so forth. And beside these VOCs, otherwise referred to as variants of concern, there is also the VBM, that WHO refers to them as variants being monitored. And because a lot of people ask that, how come we jump from Delta to Omicron? So these are all Greek alphabets, and we have other variants being monitored, like the epsilon, eta, and so on and so forth. But at this time, we know that BA2 of the Omicron variant is the dominant, and it's not clear if this is going to be the last variant of concern circulating, but we know that it's quite dominant here in Ontario and across the world. And the slide on the right-hand side is specifically what has happened in Ontario long-term care. We saw the first wave again in early 2020, and then we saw the second wave sometime in September of 2020, and then in December of 2020, right up to January of 2021, we kind of flattened the curve in the long-term care, thanks to the vaccination that came in January of 2021. So from that period up to December or November of 2021, things were kind of stable in long-term care. And then again, in December of 2021, we saw a huge peak that was driven by the Omicron variant. And then lately in February of this year, we went into what seemed to be like the beginning of another seed wave, okay, which is characterized by a subvariant of Omicron. So this is how we have, gone through the pandemic, and we enjoyed quite a good period from January of 2021 up to December of 2021 before we again started engaged with an uptick of cases due to Omicron.